So now let's talk about the prevalence of autism and what's been happening with that. So if we really look at how common is autism, we know that it's not the most common disorder, right? ADHD is, but about 1% of the population will have an autism diagnosis. As described in the previous video, we know that this is a more heavily prevalent boy disorder, so males are more likely than females. So some of the things that might protect girls a little bit better is having better social and linguistic functioning. Just in general, most girls are going to have a little bit better functioning. So there may be something about boys in the womb having a lot of testosterone, which is an organizing effect, but it may have a certain type of effect on the brain as well. So that high levels of testosterone may actually impact a male's brain. And when females don't have that, they may be protected from some of those effects. We also see that there's a prevalence that's higher among non-Latino whites. So basically, white individuals are more likely to be diagnosed with autism. That may be due in part to access to care and access to resources to actually have that diagnosis. And we also see that same thing with the ASD prevalence is higher with higher socioeconomic status. And maybe that has to do with access to care, and we can also talk about how that has to do, it might have something in part to do with actually age as well, right? So one of the things that's been really interesting is how we've been tracking autism over time and what the prevalence looks like in the United States. So this is the same study that they've been doing since 2000. So what they do is they take 8-year-olds and they see what the prevalence of autism is in the community. And so in 2000, with the birth year of 1992, it was about 1 in 150 children were diagnosed with autism. Currently, it is 1 in 54 kids. And this is the newest data from 2016, which is the surveillance year. So we're seeing this really big increase, and you have to be wondering, well, why? Why is there such a jump in the increase in the prevalence of autism? Is it due to something in the environment? Is it due to something like vaccinations? No, it's not. No, it's not. No, it is not due to vaccinations. But people were asking themselves, well, why would we see such a big increase? So I would ask you to do some breakout discussions right now, but since this is just a quick video, let's delve into it. Why are they rising? So I thought it would be really interesting to actually give us an overview of how did they do this research? How did they find out that it went from 1 in 150 kids to 1 in 54 kids? So the CDC study, what they did is they take 11 different sites across the United States, and they look at all children that are 8 years of age in that area. So if they, you can kind of see a little bit. So in Arizona, what they would do is they take a city in Arizona, look at all of the children that are 8 years of age in that area, look at medical records and school records for autism. And then they then do a clinical diagnosis. So they kind of combine all that data together and say, yeah, child A has autism and child B does not. Then they generalize the data to the wider US population. So ask yourself, what are the pros and cons to this approach? What's going on here? You know, one thing that I'm just noticing is if I look at the sites, there's 11 sites. It's not evenly spread across the United States. So for example, there isn't as much in the Northwest, for example, or it seems like there's a lot more that are kind of in this Midwestern, southern region that we have more of these sites that are participating. So maybe it has something to do with that. So there is a lot of pros to this approach. So we're trying to get all kids that are in a given area, so it really gives you a snapshot, and we can look at all those children. So we're not seeing an under or over diagnosis because we're trying to really just capture what's out there in the environment. So you aren't going to see a bias, for example, about all children who went to one hospital, for example, rather than a secondary hospital. But our reliance on school and other medical records really might not be very good with our different diagnoses. So, for example, some children might have been reclassified when it came to services. So school services used to just be for example, like developmental or intellectual disabilities, but they were not giving services for children who were diagnosed with autism. However, that changed, and so now you can get services in the school system for a diagnosis of autism. So some children may have been misclassified before and now are classified as autism now. Another thing that's really important is just variability in all these different states. And it may have to do with some of that awareness and services. So this is really looking at all the different sites. So at the bottom you see the states, so Colorado, North Carolina, Colorado to New Jersey. So what we have here is on the y-axis, it is the number of children per 1,000. So 10 children out of 1,000 were diagnosed in the state of Colorado with autism, compared to in New Jersey, that's more like almost 30 children per 1,000 children. So there's quite a variability there, and it may be due to just different services, how aware schools are, or other types of like medical communities to actually having these autism diagnoses. So looking at our actual research methods and research studies can give us a little bit of an idea about why diagnoses might be rising, but it may be due to just having better diagnoses in general. As I was explaining before, in 1991, you started to see that special education now covers autism, whereas before that it did not. Still, that doesn't explain everything because, well, a lot of those kids that we were studying are born in 1992 or later. But we also have this increased awareness. Autism really became a bigger thing, after the 1998 study that was done about vaccinations and autism. The Wakefield study came out, and by the early 2000s, we had a lot more awareness about what autism is. It definitely was not something that was described or discussed when I was growing up in the 90s. So this is definitely a big change and shift. And we also know that there's a lot better screening in pediatric offices. So there's great examples here about learn the signs and act early. And there's even a really great book called Where is the Bear that you can download for yourself. But this is for 2-year-olds to read to your children who are 2 years old. And parents, look for the leaf to learn about important developmental milestones. So by age of 2, most children will follow simple instructions. So where is Bear? Let's cover our eyes, like Bear does, to find out where Bear hides. So this is a really great way of starting to try to get out the discussion about how do we actually start trying to diagnose this a lot earlier. So that was a little bit about the prevalence of autism spectrum disorders and how it changes based on things like our awareness. So yeah, that's it for this video.